It's great to welcome to the program today John Barry, who is author of the book The Great Influenza, the story of the deadliest pandemic in history, also professor at Tulane University School of Public Health and Tropical Medicine. John, so great to have you on.
Thanks.
So
Happy to be here.
we've heard a number of different assertions made about the flu pandemic of 1918 from the president and from others, sort of in the context of coronavirus. Let's just figure out a little bit more about that. What are the origins of that pandemic?
Well, no one knows for certain. Like COVID-19 and animal virus, all influenza viruses have their natural reservoir in birds, but they can infect mammals. And animal virus jump species to humans, spread around the world, infected about a third of the world's population, and killed 50 to 100 million people. Adjusted for population, that would equal about 220 to 440 million people today. So fortunately, as bad as COVID-19 is, it's not nearly as lethal as the 1918 pandemic.
What was the sort of full duration, as we understand it, of that pandemic?
Well, it really in total covered from the spring of 1918 until the fall of 1920. However, two-thirds of the deaths, perhaps more than two-thirds of the deaths, occurred in a 14 or 15-week period in the fall of 1918. The first wave was very spotty. We're not really sure exactly, but my guess is although it was pretty widespread in Western Europe and in U.S. Army camps in the spring, it probably missed most of this country and most of the world. I think the virus muted. That spring wave was also very mild. So mild, there were medical journal articles that said this looks and smells like influenza, but it's not killing enough people, so it's probably not influenza. That turned around very rapidly. The virus mutated, and then you started seeing scientists saying this looks and smells like influenza, but we've never seen an influenza that killed like this, although it was, of course. And that second wave, as I said, 14 to 15 weeks from mid-September through most of December. Then there was a third wave in late winter and early spring of 1919. So that's very unusual to have two waves of influenza in the same influenza season. Very unusual. So the virus had mutated again, I guess. Then in 1920, it came back. And that was pretty much it. That the virus probably mutated further toward mildness. And in addition, our immune systems, having seen it several times, began to deal with it more efficiently. So it gradually became seasonal influenza.
Do you know why the president often refers to 1917 when talking about that pandemic?
I have to ask him.
Okay, there's nothing from your
There's
understanding of the history.
absolutely nothing scientifically or epidemiologically that would justify calling it 1917. My
Okay,
guess is that he said it once, and he doesn't like to admit any error over even the tiniest things. So rather than correct himself in future, he just kind of wrapped his arms around it, as he seems to do with other mistakes.
fair, fair. In terms of the name, often called the Spanish flu, can you talk about, number one, why it has that name, but also sort of the early hot spots that we often think about as the places where it really started to spread?
Uh, Most likely explanation for the name is that Spain was not at war. The warring countries censored the press. They didn't like to print anything that was negative, that might hurt morale, that might hurt the war effort. Spain wasn't at war. Plus, the king got sick. Celebrity culture then as now. So the Spanish press wrote about it, and other newspapers around the world wrote about it, and it picked up the name Spanish influenza, except in Spain where they called it other things. Uh, the first known eruption was actually in January in rural Kansas, the southwest corner of the state. Then in early February, we see it in New York City. It hit the Army camps first in Camp Funston in Kansas, Fort Riley, in early March, spread to about half of the Army camps in the United States during the spring, seemed to travel with the U.S. troops to Europe, although it would have gotten there anyway. As I said, it was in New York and almost certainly other places, even before the Army camps, so it would have spread eventually. But the U.S. troops did seem to bring it to Europe in late March and April. They accelerated the spread, as I said earlier, widespread in Western Europe. Ludendorff, the German commander, launched an offensive to try to win the war before American soldiers arrived in large numbers. He blamed an outbreak of influenza among his troops for the failure of that offensive. Of course, I think that's looking for an excuse. There was influenza on the other side of the trenches as well. Although the first known cases were in January in rural Kansas, the scientific community thinks that and it is possible that it actually started there, and I advanced that hypothesis in my book. But there's been a lot of work since my book came out originally in 2004, and I myself have backed off the Kansas hypothesis. I think it's more likely it started in China. Other hypotheses, some very good virologists think it started in France. Vietnam's a possibility, and you never know, it could have been New York City. Most virologists think that it was circulating for at least a year, perhaps learning how to better infect humans. And some think it was circulating for a couple of years. So again, we'll never know where it actually did start. That spring wave was spotty and mild. In July, the first widespread outbreaks of the lethal second wave were noted in Switzerland. In fact, it was so bad in Switzerland, U.S. military intelligence report said that this is being called influenza, but it's actually the Black Plague of the Middle Ages. It wasn't. It was influenza.
When it comes to obviously medicine was very different at that time. International travel was different at that time. Media was different at that time. When it comes to mitigation, what was it that was done? We talk about the quarantines and the shutdowns are unprecedented, and in a sense they are, but there were also some of these techniques applied back then.
Exactly. Most cities in the United States, not quite all of them, but very close to all of them, closed all sorts of things. They weren't actually quite as extreme as what we've done. They closed places of public gathering, schools, etc. Most of them did it too late to have maximum impact. Just as I think in the United States, we closed down too late to have maximum impact. As we're speaking, there was a study from Columbia University that came out today that said if we had closed down a week earlier, we would have saved more than 1/3 of the lives that have been lost so far. And if we had closed down 2 weeks earlier, we would have saved about 60% of the lives that have been lost so far. Similar things happened in 1918. Most cities closed down too late to have maximum impact.
When we think about the communication that we now see of federal and state guidelines here, augmented by television, radio, internet, social media, etc. How was it in 1918 through 1920 that most people were learning about what was supposed to be done to stop the spread?
Well, of course, print was the only media. You didn't even have radio yet. Uh, you had rumor and you had print. Uh, we were in a different situation then because of the war. The government, the Wilson administration, focused everything on winning the war. They passed a law which made it punishable by 20 years in prison to, quote, utter, write, print, or publish any disloyal, profane, scurrilous, or abusive language about the form of government in the United States. So you could curse some action the government took and you just broke the law. Truth was not a defense. This law was prosecuted vigorously. Congressman was sentenced to more than 10 years in prison for this law. It's also the one that a couple of memorable phrases came out of the Supreme Court decision, which actually upheld it. Oliver Wendell Holmes, who is generally considered a real upholder of freedom of speech, actually wrote the opinion upholding this law. And he used the phrase clear and present danger in his opinion, along with the analogy you can't shout fire in a crowded theater to justify upholding this law. Anyway, that was important because, and also the government had created a propaganda arm, and the architect of that, what was called the Committee for Public Information, wrote that nothing in experience teaches us that truth is superior to falsehood. The value of an idea lies in its inspirational value. It matters very little if it is true or false. So on the one hand, the government was lying to people in order to keep morale up for the war. On the other hand, they were threatening people with 20 years in the can for telling the truth, if the truth seemed critical of the government. So influenza fell into that infrastructure. National public health leaders associated with the government said things like, this is ordinary influenza by another name, or you have nothing to fear if proper precautions are taken. Neither of those statements were true, but they were echoed in most places around the country. Many, not just echoed, but quoted verbatim in most cities. So initially, people were led to believe this was ordinary influenza by another name. But it didn't take long. We're talking about almost a matter of days before they realized this was something very different.
I wish we had more time to dig into it further, but I do want to make sure people know the book is The Great Influenza, the story of the deadliest pandemic in history. And we've been speaking with the book's author, John Barry from Tulane University. John, I so appreciate your time.
You're very welcome.